in response to the major changes in healthcare provision, which are health and social care provision, which are taking place across North West London. The aims of the group are to gather patient experience and views of moving services out of hospital and into community settings, to examine the underlying causes of unplanned and unnecessary admissions to hospital, to help local people stay informed of service changes and development. The group's so far met 5 times, and we've heard from a variety of speakers, including the Hammersmith and Fulham Clinical Commissioning Group, talking about their new virtual ward project, which is the aim is to stop people going into hospital unnecessarily. The future design of Charing Hospital as a local hospital, the whole systems integrated care programme, open patient participation group initiatives, and the Link Line project. Earlier this year, the group undertook some research, and this was to look at patient reactions and why they used the following services. So that's GP services, A&E, urgent care centres, the Parsons Green Walk-in Centre, and the NHS 111 telephone service. And the aims of the research were to discover what health conditions took people to these various service providers, to discover why people chose to access these various providers, and also to identify, very importantly, what barriers there are to accessing these service providers. The method used was a survey and a series of focus groups, and in all over 200 local people were spoken to. The main findings of the study were reasons why they used the GP service were convenience and ease of access. And that's why people choose a GP over another primary care provider. Half the respondents were not aware of the location or purpose of an urgent care centre. A large number of respondents would access A&E services if they could not get an appointment at a GP service. The main barriers to accessing GP services were accessibility of appointments, communication barriers, and opening times. And finally, there were low levels of awareness of the NHS 111 service. Only 20% of those surveyed had heard of it. A report's been produced, and the full report will go to local commissioners and help design changes in primary care and urgent care services. Thank you very much.